Proper nutrition is essential to maintaining our body's health, growth, and ability to heal. Various medical conditions can make it difficult or impossible for a person to receive the nutrition they need by mouth. In these cases, a gastrostomy tube is inserted to supply direct access to the stomach for feeding. At Applied Medical Technology, we recognize the need for a convenient and effective means for delivering nutritional formulas into the body. With over 20 years of experience in the medical field, Applied Medical Technology is a worldwide leader in the design and development of low-profile feeding devices. The AMT mini balloon button is a silicone replacement device that is inserted into an existing gastrostomy to enable feeding, decompression, or venting, and administration of the medications directly into the stomach. Its low-profile design is comfortable and allows the patient greater mobility. Every mini balloon button comes in a sealed sterile tray with a 10 cc luer tip syringe and 2 pieces of sterile gauze. The label on the mini button tray has 3 peel-off stickers. Please be sure to remove at least one and save for future reference. The patient care kit includes a bolus feeding set, a right angle feeding set, and a 60 cc catheter tip syringe. Your caregiver's reference guide contains detailed information about the mini balloon button. Please be sure to familiarize yourself with it. Let us begin by looking at the parts of the mini balloon button and what they do. The external base maintains tube position at the patient's skin level. A properly fitted device should not fit tightly against the skin. A 3 mm gap between the external base and the skin surface is recommended to provide room for air circulation and cleaning of the stoma site. The feeding port allows access to the stomach for feeding, decompression or venting, and administration of medications. It should remain sealed with the safety plug when the device is not being used. The anti-reflux valve, located in the bottom of the feeding port, prevents stomach contents from leaking out of the tube. The valve is opened when a feeding set adapter is inserted. Do not attempt to put anything other than a mini feeding set into the feeding port. The silicone retention balloon is located at the end of the button and is inflated inside the stomach to hold the tube in place. It has been designed to be very soft and comfortable, and its superior apple shape prevents leakage. The silicone retention balloon is inflated and deflated by inserting the luer tip syringe into the balloon fill valve. It should only be used to check or adjust the balloon volume, or when replacing the mini balloon button. Do not attempt to feed through the balloon valve. Now let's look at the patient care kit. It includes 2 types of feeding sets. The bolus feeding set with single port is intended for short duration feeding. The right angle feeding set is used for continuous feeding. Your doctor can advise which feeding set best fits your needs. The kit also includes a 60 cc syringe that fits into the bolus port of the bolus feeding set and the feeding port of the right angle feeding set. The syringe can be used for bolus feeding, administering medications, and flushing the mini balloon button and feeding sets with warm water. Feeding sets should be replaced every 2 to 3 weeks and can be obtained through your care provider.